According to a report released by Uganda AIDS Commission in 2024, Uganda has an estimated 1.43 million people living with HIV as of December 2022. The report indicated a decline in new registered cases and HIV-related deaths from the 2019-2020 baseline of 54,000 and 21,000 to 51,516 and 17,000 in 2022-2023. The report emphasized the need for increased efforts to achieve epidemic control. In an interview, Dr. Charles Otai, the Monitoring and Evaluation Officer at the Uganda AIDS Commission, stated that the country is making steady progress towards a Uganda free of HIV/AIDS by 2030. He noted a significant decline in new HIV infections from 96,000 in 2010 to 37,000 in 2024, a 60% reduction.
We also see that the infections have also come down, in that by 2010, we had about 96,000 new HIV infections in a year. But by 2024, we had 37,000 new HIV infections happening last year. So that's about a decrease of about 60%. And when we talk about our goals and targets, we want to have about, by 2030, we should be having about 10,000 new infections in a year. So we are hopeful that if we have 37 by 2024, by 2030, if all goes well, we shall have less than 10,000 new HIV infections in a year.
He noted that HIV-related deaths have dropped to 20,000 per year as of 2024, a sign that ongoing efforts are yielding results. However, despite a national prevalence rate of 4.9%, challenges remain in high-burden areas like Fort Portal City, where prevalence rates stand at 14.1%.
Even the deaths that are related to AIDS have also drastically reduced. In the 2024, we had 20,000 people who died out of due to AIDS-related deaths. So all those are signs that we are doing very well. However, the burden is still high in the country, in that while we have a prevalence of 4.9%, we have the prevalence varying in different geographical locations and subpopulations. For example, when we talk about the geographical locations, we have got a prevalence of about 14% in Fort Portal City, which is a bit high, unacceptably high. And even places like Chotera, with a prevalence of about 12%, which is a fishing community.
Dr. Otai urged for intensified efforts in high prevalency areas and highlighted that young people aged 15 to 24 years remain most at risk. He emphasized the need to focus interventions on youth and the most affected communities.
So we need to take care of those subpopulations. Even the new HIV infections are happening mainly among young people, age group of 15 to 24%. Sorry, at 15 to 24 years. Like I mentioned earlier, out of the 37 new HIV infections, 14,000 are occurring among the young people. So we have to direct our interventions to target those subpopulations which are likely to be drivers to the epidemic. And if we do that, then we're able to achieve our goal of ending AIDS by 2030 as
Dr. Otai noted that the Ministry of Health is now integrating AIDS programs into primary health care, a move aimed at reducing stigma and encouraging more Ugandans to access HIV services at all levels of the health system.
Trying to cope up by integrating HIV and AIDS programs into primary health care. And this will help us to fight stigma. Because when a person enters a facility, nobody will know that they've gone to go for HIV services or not. So we need to build capacity among our health workers to be able to receive people who have been getting treatment for AIDS in a different clinic.
Social workers Daisy Kandole and Huzaifa Sali also added their voices, urging the nation to rally behind all efforts aimed at ending HIV/AIDS by 2030. They called on communities to actively participate and support interventions to help achieve this national goal.
Do I think that we are going to reach our 2030 target, that is ending HIV by 2030? I think yes, it's possible, but only if we act deliberately. And what does this mean? It means that we need to invest in community-led and youth-led interventions by putting young people and the communities at the forefront and at the center.
What I think we can do, well, first of all, we as a community need to keep working hand in hand. We also need to acknowledge the fact that our children are sexually active. The sooner we realize that, the more we are going to set up measures to ensure that they are not exposed to HIV and AIDS.
Bob Muhuma, Family TV, News at 8.